Good morning. This is the Wise Owl 2 coming at you from the city where I live. Today I want to talk to you about skin care. If you are a type 2 diabetic or a diabetic and you suffer from very dry skin and it gets worse and worse, and you wake up every morning with scratch marks, maybe some open little sores or something like that, but mostly scratch marks or streaks. And don't worry about it. Dry skin causes the scratch marks on people who are not diabetic. But those who are diabetic, type 2 for example, they tend to have even worse and deeper skin problems and skin issues. Especially if you cannot control your sugar, you have skin blotches, you may get little open sores, you may get scratch marks and everything. You should have to see your doctor as soon as you get those things. As soon as you get those marks, see your doctors right away. Because your sugar may not be under control like you think it is. So, your blood sugar, you may think mentally that you're controlling your sugar, but you're not. Okay? But as for the dry skin and the scratch marks, don't worry about that. Sometimes the only thing you have to worry about with the scratch mark, if it's too much open or too deep, then you have to use an antibiotic. For example, a Neosporin. You put some Neosporin on the scratch mark every time you, I'll say about twice, 3 times a day. Let me see what it says here. It says pain, itch, and scar ointment. It's a topical medication. And you put that on your sore, around it. You shouldn't put it too. If it's too deep, your scratch, don't put it on there. Don't apply it. But if it's surface or very light, you can apply it. Okay. Then you have to. Here's a product that really, really works. People swear by it, especially diabetics. This is Go Bond Diabetic Dry Skin Relief. And if you see here, I don't know if you can see it. Let me see if I can put it a little close up here. Let me see. No, you can't see it still. Well, let me see. It says 9 out of 10 people with diabetes saw noticeable skin improvement in 1 hour. Okay? It's a hydrating lotion, and it really, really works. I have dry skin, and I said to myself, I'm going to put this on my skin to see if the scratch mark I get may come out. And you have dry skin when the skin is like white. You know what I'm saying? You know that you have to put some kind of lotion. You can put regular lotion, but sometimes regular dry skin lotion over the counter doesn't work that well. But this kind for diabetes, for some reason, works wonders. Go Bond, it works wonders. I apply some to my scratches, and it's healing. But you have to also control your sugar. Control your sugar while you apply this on your scratch marks, and you'll see that you start to heal slowly but surely. Okay, because being diabetic, you heal slowly than most people who are not diabetic. Here you go, see it, right there. 9 out of 10 people. Okay? All right. Okay, and it works. It says right here. Let me see where my thumbs. See where my thumbs are right here. It says right here is it's dermatologist tested, fragrance free, 24-hour moistures, hypoallergenic. Okay. That's what it says. You can put it on your body, on your legs, anywhere you want to put it. It's a moisturizer for soothing hydration of diabetic dry skin. It's a good thing to have. Okay? It's good to keep in storage too. About 2 or 3 of these for different seasons. However, it's good for dry skin. If you wake up with scratch marks on your legs and you don't know where they come from, it's coming from your dry skin. And if you're type 2 diabetic or a diabetic number 1, whatever, of course it's always good to see a doctor, always. Because you never know, because sometimes sometimes your skin, even though it's dry, it has a scratch mark, it may catch up, you may have a bacterial infection, you're not sure. That's why it's good to put Neosporin around it. Okay? So if you apply this according to how many times you need it, you can also apply this at the same time. Okay? For scar, see? For pain, itch, and scar ointment. Okay? First aid. It's good to have this in storage. Here's another product. I haven't used this product yet. I bought it. Oh, by the way, this product only at the Walgreens only costs about $10, $10 to $12. It's a good buy. It's a very good buy. Goban Ultimate Diabetic Dry Skin Relief. It really does work. This one I haven't used yet, but I'm going to use it soon. I can't pronounce that name. I think it's Goico Echa. Something like that. It's a product. It's for diabetic treatment. Diabetes treatment. See what it says there? Let me see if I can focus in there. Let me see if I can focus a little bit more. Okay, focus it. But it says here, especially formulated for dry, rough skin, especially from. It's also written in Spanish and English. If you read Spanish and you don't know too much English, how to read English too much, this will help you. This is written in Spanish and English, which is good. It's very good to have directions and everything in 2 languages. Okay. Okay. Now it says here, it intensively moisturizes and condition skin of people with diabetes. Okay, it says in Spanish and in English. That's why you see 2 rows. Okay, you apply this to that area that's rough and dry, and then you see if it works or not. Of course, now this one here worked like a charm. This Goban. I recommend this a great deal for those of you who have type 2 diabetes or have dry skin. If you wake up with skin marks like scratch marks, now you don't have to be diabetic to have scratch mark and dry skin. These are for people who are diabetic. And in fact, you know, I would like to recommend this to anyone who has real bad dry skin who's not diabetic, because this may actually work to heal the very dry skin on a person who doesn't have diabetic. When you wake up in the morning time and you see skin marks or scratch marks on your legs, don't get mad. Don't get preoccupied. Don't get worried. Don't be apprehensive. Don't get scared. If you want to see your doctor, that's good. Talk to your doctor. But if there's no infection, if the skin marks or the scratch mark is not too deep, if it's surface, try putting some antibiotics. Neosporin would do it. Okay, and then wait about 5 minutes after you put the Neosporin. Then put this on there. Okay, and as many times as you put this on throughout the day, every day you put this Neosporin on, and you see, and you control your sugar. Take your sugar, okay, and see and check out the sugar level. That will tell you why your skin has scratch marks on them. Because if you see black patches around on your shin, or if your skin of your legs start to get darkened, like a darkened brown, go see your doctor, because you have a skin problem. He'll recommend you to a dermatologist. But this will help you out if you control your sugar. Controlling your sugar. So if you have a scratch mark, take your glucometer, your glucometer, what you want to call it, glucometer. Take your blood sugar and see what the level of your sugar is, and then you know you have to go lower. That means you probably reach a level high in sugar, or your sugar is it's out of control, where it's showing you where your skin is being affected. It's being affected by the high sugar level. Now, to give you those marks and heal, and see any remark improvement, it's not only to see any improvement. It's not only putting the Neosporin or the dry skin ointment or lotion, Go Bond, or this one here. It's not only a matter of doing that, but you have to control your sugar level and do some exercise that would add circulation to your legs. I go on the treadmill. I go on the elliptical. It works. Okay? And if you sit down a lot, if you lay down in your bed, or if you sit a lot, watch a lot of television, or if you read a lot of books or stay in your computer, or you sit down too much, your leg may swell. They may swell around the ankles and shin and everything. Don't get scared. If you know that you're sitting down a lot, put your legs up very high, okay? And after 1 or 2 days, you should off and on, of course. But put it high, like not like this, but put your legs high like that. Sit on a chair. Even when you're watching television, you can sit on a chair and put your leg on top of a table like that, with a pillow or a cushion, because the edge of the table will hurt your legs. Put it up like that, off and on for a couple of days, and your swelling will go down. But control your sugar, okay, and monitor your blood pressure in case you suffer from high blood pressure. Okay, drink your water as recommended. Check your urine for the color of your urine would tell you if you need more water or not. Okay, you know that if you go on the treadmill and you sweat, or the elliptical and you sweat, you do exercise and you sweat, you may require more water, especially if you're diabetic. Okay, to let you know, you don't have to worry about too many things. Today, there's a lot of medical knowledge, a lot of research is going on to help people with diabetes, and don't be afraid. Okay, if you're not much afraid of anything from your scratches or your swollen legs or anything, always see a doctor. Especially with a swollen leg, see a doctor. And if you sit down a lot, let your doctor know that you sit down a lot. The computer, how many hours and everything. That way he'll tell you what's wrong with your legs. Where it's your kidneys, your heart, what is too much salt. If it's sitting down too much, he'll let you know. Of course, you should always see a doctor if your legs are swollen, a lot. Let me tell you a story about me. I was watching television for a little while. I was tired. I was too lazy to do my exercise. My sugar was not too low or normal. My sugar was a little high. I ate some food and some sugar, and I sat down and watched television for many hours. And I noticed as time went by, my ankles, my legs were swollen. My family noticed it too, a great deal. See, but then I realized that when I go on the treadmill, when you go on the treadmill for a long time, I go for an hour, and on elliptical and exercise for an hour on my foot, and I also walk around outside for many miles outside, and sometimes your foot will swell. And also I will sit down for many hours afterwards, watch television, or read a book, or go on the computer to study and everything. My legs will swell. So getting scared, being afraid, I put my legs up for about a half hour, 2 or 3 times a day. After 2 or 3 days, my legs went back to normal. So if you do a lot of walking, if you do a lot of running or walking on your treadmill or elliptical, if you sit down a lot, the swollenness may be due to that. Lots of people who are not diabetic, who do not have high blood pressure, who do a lot of sports and who do a lot of walking, secretaries, you just name it, anybody who walks around a lot, doctors, nurses, whatever, complain of swollen feet because they walk a lot. See, and the shoes you wear, if it doesn't have insoles, orthotics, what do you call it? It's then your legs may be too irritated. It may be too sore from walking. So anything can cause your legs to swell. So don't get scared, okay? Not everything that happens to a person is tied to diabetes. It's not. It doesn't mean, oh, because you have type 2 diabetes or type 1 diabetes doesn't mean that a swollen leg is due to that. And scratch marks can be healed. Okay. Now, if you think you have an infection, see your doctor, of course. He'll prescribe to you a better medicine. But this Neosporin will do the trick. If it's deep, scratch, don't put it on you. Put it around it. Okay. All right. And if you have an ingrown toenail, don't take it out yourself. Don't take it out yourself unless you have a peroxide and Neosporin and you have this Gold Bond to moisturize your legs afterwards, your feet. Don't put this around your toes. Don't put this up between your toes because it may cause a fungal infection. Okay? This is why you should see a doctor, a foot doctor, for your ingrown toenail. Okay? Now, this is how it is. Now, this is very important to have. This and this. This hasn't been used yet, but I think this is more for certain special spots. This is for more wider spread on your body. Now, if you have dark marks under your elbows, around your elbows, because of diabetes and dry skin, well, the dark patches under your arm may not be dry skin. It may be a sign that you're diabetic. You should see a doctor. Any dark skin. If you see dark skin around your shin, around your lower legs or anywhere, see a doctor because you may become a diabetic, or your diabetes may be out of control. But if your elbow has darkness in it around it, dark patches, it may not be diabetes. It may be just a rough, dark skin caused by dryness. Put this right here on that spot for dryness. See what happens. All this too. Okay. Walgreens, all this costs about, both these things here cost about $10, $12. This doesn't cost much too. For $25, $30, you get the whole bunch, the whole lot. And always have a storage of peroxide, hydrogen peroxide. You're going to need that, okay? In case you catch any kind of infection, and cottons and stuff like that. And bandage, always a band-aid too, you never know. Well, this is a Wise Owl coming at you. If you like my video, give it a thumbs up. Share with your friends. This is very important. The information I'm giving you is very important. I think you should share this with your friends, but mostly your diabetic friends and anyone with dry skin. You really should send this video out. You can subscribe to my Wise Owl 2 channel or site. You can, and if you like it, give me a thumbs up and leave a comment, okay? Maybe you've been using a different kind of product for your dry skin, especially if you're diabetic. I would like to know about your dry skin, how you healed your dry skin, how you treat it, and what you did, how you did it. It's always good to have more information. I gave you information. Maybe you'll give me more information, right? We help each other out with information. So if you want to leave a comment, any remarks, hey, okay? If you have a better topical antibiotic than Neosporin, hey, let me know. Knowledge is power, right? We all help each other. That's how it is, right? Okay? All right. This is the Wise Owl 2 coming at you from the city where I live. And, well, take care of yourself, okay? And if you wake up with scratch marks on your legs, and it's probably dry skin. You know how you know? You scratch. Take your nails, your fingers, and scratch gently around your legs. If you see a white scratch mark, not too deep now, it's dry skin or whiteness around it. Okay? Don't be afraid. And if you sit down for a long time, or you walk around a lot and you squeeze and your foot swells or your feet swells, put your legs up. Not like this, but like this. My hand is my buttocks on the chair. My feet, my legs are like this, high. Okay? It's going to hurt you in the beginning. You're going to feel uncomfortable. You're going to feel tired and uncomfortable to put your legs up like this. But you get used to it. Okay? You got to drain out your legs, okay? It's normal. Anyway, doctors recommend that you should put your legs up once in a while. It's healthy and it's good for you. All right? This is Wise Owl coming at you from the city where I live. Over and out.